Laboratory investment matters because it saves lives and saves money and contributes to better outcomes. Right now, we've recognized through the different outbreaks, pandemics we've had in Africa, that laboratories are a very important critical piece of fulfilling good health outcomes. And the funding and the opportunities that are available have been in silos in different diseases. So there's a need to integrate the laboratory services so that we have a good use of money and get good health outcomes.
It's really extraordinarily important that we up our game in terms of how we advocate for laboratory system strengthening and health system strengthening. Without labs, we're shooting in the dark. When we're trying to provide care, we don't know what we're doing without labs. I don't think it's an option to think of them as optional.
There's been siloed investment in almost all aspects of disease diagnosis, funding that are not tailored to the community, to the national expectations in the community, in the government. And that has not addressed the issues that are required to help global health, WHO, and the big donors achieve what we're calling the universal health coverage.
It's through laboratories that we are able to detect epidemics early and be able to respond early and in a definitive way so that we are able to stop them at source.
We are investing a lot of energy and resource to fight antimicrobial resistance, but I think we need to look on the cause. And for that to happen, we have to have a good diagnostic tools to be sure that we put on correct treatment our patient. I feel that from the COVID pandemic, leadership is key. If we would like to succeed, and this meeting we have now can have really tangible impact in the future, we need to follow this pathway: leadership, programmatic, and financial.
Laboratories usually are forgotten and really weak links on the health system, especially in the African context. So the outstanding message that came out is on the importance of working together and integrating the lab services, not only looking the lab from infectious disease perspective, but looking into the whole continuum of care, like non-communicable diseases, the environment, and antimicrobial resistance, all those big issues that the laboratory can play an important role. So I think that came out very, very clearly.
It is not just about money. All this issue we're talking about today, the very first component that we have is what we call the political sustainability. Politicians have to be at the lead. Policy change has to happen for us to move from silo to integrated diagnostic. We are struggling with that because the policy is not there and it takes a long time. Some of the policies have been developed and not implemented. So political sustainability is more important than money.
Diagnostic network optimization is a key part of what we've been talking about this morning. I think in order to do that at scale, we're really going to need more resources, more investment, more people, and better trained cadre of health professionals to take this forward.
This meeting is very important because we want to elevate our voices. We want to, bring the attention to diagnostics, and we have the opportunity right now because of some of the global commitments that have been made towards diagnostics. So investment in diagnostic matters because we are able to detect, we are able to respond, we are able to address challenges that we may face on time.